At this time, I'd like to turn today's program over to Canada Health Infoway. The floor is yours.
Thank you, Michael. Welcome, everyone. This is Fraser Ratchford from Canada Health Infoway, and I'd like to welcome everyone to this Digital Health Week event. This is going to be an interactive session, and so we'll be looking forward to your participation during this webinar. With Canada Health Infoway and the University of British Columbia eHealth Strategy Office, we're both proud supporters of Digital Health Week. I'm joined today by Dr. Kendall Ho, and our patient, Iris, should be joining us momentarily. But before that, let's go over today's format, and I'll just sort of go over a few housekeeping notes with you. We want this to be interactive, so Dr. Ho and I will be having a conversation. We'll want to take your questions. So if you have a burning question on how digital health will impact clinical practice, we want to hear about that. Or if you want to know more about digital health and how it can help you as a patient, we want to hear your questions and we want you to be part of the dialogue. So this is your time to talk and think digital health. As Michael said, your phone lines have been muted. For the next little moments, myself and Kendall will be giving sort of some context for today. So we want you to sort of understand digital health, and then we want to hear from you. I will moderate the question period as we have this roundtable discussion. It's easy to submit your questions. As you can see on the slide that's up, in the upper right-hand corner, you'll see a little box there that says Q&A. If you click that, then the Q&A box will open below, and then you can type in your question. Once you type in your question, we will get it as part of the ones that come in so that everyone can then hear. I will introduce those questions so that everyone then can hear what question is being addressed at the moment. Because this is a digital health event, we want to make sure you think digital health and that you actually use Twitter, and we encourage you to live tweet during today's event. The hashtag is #ThinkDigitalHealth. If you're watching this event as an archive, you can still take place in the discussion by sending your comments or questions to the same hashtag, #ThinkDigitalHealth, or at the Infoway handle. You also can visit us at betterhealthtogether.ca. I'll be speaking a bit more about digital health when we close the session, but let's get on to the presentation. So today's discussion is about, we want to hear from Canadians about their involvement in digital health. And we know Canadians want to become more active members in their own healthcare team. Digital health represents that ability for them to do that, and it's facilitating a more connected health system. And that health system includes you as part of that team. Digital health connects patients with clinicians, no matter how remote their communities and even within their own homes. With easier access to health records, lab results, and even prescription information, patients are empowered to play a more active role in their health, and healthcare providers can provide safer, faster, and more effective care. Increasingly, consumers are using digital health to book or cancel appointments, check their lab results, and renew prescriptions. They even monitor their chronic conditions using consumer health tools. Digital health tools are now changing how Canadians interact with their healthcare teams and contribute to improved care for themselves and their loved ones. So that's setting up a bit of a context around consumer health and consumer digital health specifically. And so what I want you to do is start thinking about the questions that we've posed on this. How is digital health being used in your setting? From a patient engagement, what are your different perspectives? How is it impacting you? Have you used digital health tools? So those are questions that we will want to pose to you. Please use the question chat box to facilitate that so that then we can make sure that your questions are addressed. I'm now going to turn the conversation over to Kendall, who will give you sort of his perspective on the context and set out for the rest of the conversation today.
Great. Thank you very much, Fraser. It's hi, everyone. This is Kendall Ho. I'm emergency doctor at Vancouver General Hospital, and I'm also the Director of eHealth Strategy Office at UBC Faculty of Medicine. Really, it's my privilege, my pleasure to be here, to join Fraser and to work with Infoway on the Digital Health Week, and also it's tremendously exciting to participate in this event. I'm going to only speak for maybe 3 or 4 minutes to lay out a little bit of context, and I'm really looking forward to your questions and also interacting with Fraser in some dialogues together about exploring eHealth and how do we engage our patients and the public in the uptake of eHealth. I know that when I first started in 2003, at that point, eHealth really limited to a very fixed network and a very small number of people participating. Considering that most, if not all, of our hospitals are digitized, we have really shifted over the last few years into a whole digital health care. And it's just tremendously exciting to have this opportunity. And also, recently, a few surveys, for example, a recent North American survey in the beginning of this year asked seniors defined as 65 or over how they may want to use technology to support them in their health care. 2/3 of them want to use digital technology. 2/3 of 65 and older want to use technology to, 1, support them in seeing and connecting with their health professionals and telehealth. 2, having wearables and sensors so that they can be monitored remotely and they can monitor themselves to participate in care. And 3, to be able to access their own health record so that they can manage their health better. This is an amazing time for the opportunity that patients are really fired up. And also, in terms of health system investing across Canada in the electronic health infrastructure and health professionals increasingly using this. This is an excellent, extremely interesting time and a great time for us to participate in the care. The question is, with so many of us interested, how do we make sure that we work together? Because at some point, just like the internet when it first started, I think it's great that everybody contributed, but eventually we need to figure out pathways in the internet in terms of how we search information, how we book travel, how we look for information. In the same way in eHealth and digital health, how do we help ourselves to work together towards that? I think patient engagement is vitally important. I apologize for a typo on the slide. It's actually HIMSS, H-I-M-S-S, and it's a U.S. organization very much in the whole digital space and has been working very strongly in terms of engaging different groups for eHealth. And they have recently, over the last few years, released a patient engagement framework in terms of how do we support patients to participate in the eHealth revolution. And I think they divide it into kind of 5 stages. It makes a lot of sense to me. One is, how do we inform our patients of the types of changes happening in eHealth? I think that's very important. But the next step is about how do we engage the patients together in understanding what are the tools coming down the pike, what's the meaning of those tools, and how do we best use those tools for that activity. And then the third step is, how do we support and empower our patients to use those tools, not only support in their own care, but also to participate in line with the health system and access the type of health care that's available. And then I think the last 2 steps are really exciting. How do we not only support the individual patients to be informed, engaged, and empowered, but how do we partner with our patients together for the best of care? There's good clinical literature to suggest that engaged patients have better health outcomes. And so how do we as health system and health professionals support our patients to get the best of care and best partner with them? And finally, how do we support our patients' community of peers? There's no question a lot of patients are looking at peers to support their care, looking at caregivers. How do we also support that would be very important. And so I'm very excited about today in this discussion, and we'll speak a little bit about some of the efforts that we're doing in British Columbia. Very fortunate to be partnering with the BC Ministry of Health, together with the Patients as Partners Council, a provincial council that's set up under the Ministry of Health with many different partner organizations, to look at how do we support e-health uptake in British Columbia, and very specifically, how do we support patient and family-centered care. And we have a bit of a strategy in looking at this support in 6 ways. How do we enable patients to make choices? How do we engage them? How do we have equal partnership with our patients and health providers to move that forward? How do we leverage electronic technologies for that? How do we also build mutual expertise to support each other in terms of there? And how do we finally equip each other to move forward on this area? And our strategy really is looking at right now in the next in this year, raising awareness so that we can actually work together to understand the evolution of e-health, and also very rapidly building skills together in terms of supporting patients in navigating the health system, and also supporting health professionals to participate in this partnership and working with the health system to make sure that these tools become available. And we're very keenly interested in the public dialogue for this conversation to move forward. And so this webinar is a tremendous opportunity for us to have this public dialogue. And also you'll be meeting Iris very, very soon, and it's just tremendous to work with Iris and also a group of really activated patients together in moving forward on this. And also I'll mention a little bit about this forum that we're having this evening. And any of you interested, you're very welcome to join us in person in Vancouver. I think there's still flights coming to Vancouver if you want to catch a flight, or it is available on webcast that you can join us. And at the end of the day, this is what we want to do. We want to have everyone raise our e-health literacy. It's not about the fact that we're not literate. It's about the fact that we can harmonize and work together so that we can all participate in supporting e-health so that our patients and their caregivers get the best access and quality of care in the most cost-effective and productive way. Maybe I'll stop there. Fraser, welcome. I see already some questions coming in, which is fantastic.
Excellent.
Welcome your comments.
Well, we encourage people to continue to put in questions so that we can have an opportunity to answer them and have a great dialogue amongst the participants today. I'm going to take this moment also to introduce Iris Kish. She's a patient advocate working for Patients' Voices Network and with the University of Victoria Center on Aging. And so maybe, Iris, maybe you can tell us a bit about yourself, and then we'll start answering some of the questions that are coming through on the WebEx.
Hi, everyone. I am a volunteer with Patients' Voices Network, also University of Victoria Center on Aging, facilitating workshops on chronic pain and chronic disease, both in the community and online. I enjoy the work I do. I'm a great advocate for the patient voice, and I always say we need to collaborate to help our doctors help us.
So let's maybe take that point a bit further, Iris, because we heard Kendall talk about the importance of engagement. And maybe from your perspective, how is digital health changing the way that you're interacting with your clinical team?
One of the ways that I find is really helpful is I can get a lot of, like for example, my lab results rather are available instantly. There are also numerous apps that I can download, whether it's to my phone or to my iPad, that I can work with. Even one that has me really amazed is that I can monitor my heart rate.
You sound like a connected patient. you are. Now, Kendall, earlier you had said that 2/3 of, I think it was seniors, are actually sort of using tools that Iris has just described. And so, you know, I think a lot of people out there think that Iris would be atypical, that she wouldn't be doing that, that yet your statistic that you said was like, wow, 2/3 of seniors are actually wanting to use these tools. Can you maybe just sort of expand on that a bit, and then maybe tell me how that has influenced how you practice then with
Absolutely.
those types of patients?
Yeah, that survey is very revealing to me as a clinician to say, well, how do we best support our patients? And very interestingly, one of the top 5 is, as Iris alluded to, how do we support our seniors. In fact, they expressed the use of sensors and wearables and also use of apps to support them. And another really interesting survey is about the millennials. And it's a different survey, again, at the beginning of the year. Again, 6 out of 10 want to see doctors through telehealth, and 7 out of 10 want to use apps, not just any apps, but apps prescribed by health professionals. And so, in fact, over the last year, as an emergency doctor, when I have patients coming to the emergency department, if I see them have a mobile phone, and in fact, if they are, if there's a medical condition where I feel that there's an app that's actually helpful to them, I would prescribe them the app. I'll discuss with them, maybe show them 1 or 2 minutes how the app's done. We at our eHealth Strategy Office has a website called Healthy Apps, where we actually have a 2-minute video of some of the apps that we illustrate and I prescribe. And then I ask the patient, you may want to try using those apps yourself, and then follow up with your family doctor. So this is how it has, in one way, changed the way I practice, but highly emphasize that patients do not use the apps by themselves, always use it in partnership with the health professionals.
One of the questions we've received is, you know, we're talking about the number of people that want access to these kinds of apps, but what are the true numbers? And so I know from some of the studies that we do at Canada Health Infoway, certainly the use in Canada is probably lagging some of our other more advanced sort of partners in the world that have had sort of patient involvement in digital health a lot longer. But Iris, maybe you can sort of talk to, you're sort of a volunteer with Patient Voices. How many of your sort of friends and other people in your community are actually accessing these digital tools?
From what in my conversations with people, what I understand is that people really want the digital applications, but they are so afraid of their information being compromised. And it is actually the health system has the same laws that anybody else follows. They have to follow your confidentiality the same as the bank or anybody else. I think, in fact, they're even stronger. And I also believe that your information is safer in an app than it would be in a paper office.
Okay. Do you have anything to add to that, Kendall, around, like, have you seen the uptake by people as you prescribe them? Are people actually using them?
Yeah. Actually, a couple of Canadian surveys that are coming out recently, and of course Infoway also have done some really fantastic surveys. I think there's clearly an increasing trend for people to uptake technology. In fact, out of those that do have smartphones, we're now looking at 6 to 7 out of 10 persons who have at least one health app on their mobile phones, at least one health app. Some of them have 3 to 4, some of them more of that. And so it's because of that statistics, and also now 9.5 out of 10 persons coming to emergency department or leaving emergency department or seeing doctors would have looked up their own information on the web. That's not surprising statistics. With that combination, I think it's vitally important for us not only to support patients and caregivers to use technology, but actually work with them in partnership. That's why the active prescribing, the active partnership in using those technologies becomes so important. I think Iris raised a very good point about the security and privacy of that. I think it's important, especially if it's, usually when I prescribe apps, I'll suggest to them, make sure you do understand the type of information you give out in exchange for the type of things that you get back. For example, Iris mentioned the heart rate monitor. There are a few of them. The one that I recommend, patients give out maybe an email address, maybe a Twitter feed, etc. So you have to balance about not giving that piece of information out in exchange for getting a heart rate. If, of course, an app asks you for your income, where do you live, where do you work, you may want to start thinking about the fact that it may change. And so those types of things individually also need to be watching out for.
Okay, well, the questions are coming in fast and furious, so that we really love this participation, so that is great. Maybe, Iris, one of the questions that has been asked, and I'm thinking because you volunteer with a sort of a patient advocacy group, is Are you aware of what other sort of healthcare patient charitable organizations are recognized as engaging their members in healthcare advocacy and maybe in advocacy for digital health as well?
You know, there are a lot of them in the Lower Mainland, and I think right across the province, and it actually spans a lot of doctors' offices are coming on board. There is an organization called KEEN. UVic is also, with their self-management programs, they're into the saying that you can use a lot of apps. And one thing I really want to mention is that you don't have to spend money to download an app. A lot of them are free, and a lot of them are quite good. And there's quite a lot of choices. And as Dr. Ho says, work with your healthcare providers, always.
I think, you know, it's interesting, Iris, that you bring that up about the cost of these apps. And I think some people feel that if they paid for it, it must be of better quality. Kendall, in the research that you've been doing through the eHealth office, what have you found? Like in the apps that you recommend, you know, are they, you know, Iris has also mentioned privacy is a big concern of patients, and we want to make sure that apps that are being used, you know, sort of follow standards that have been developed. But when, you know, is it true that they should be able to get good quality apps that are free?
Yeah. On that particular point, I certainly agree with Iris that, in fact, there are good apps out there that can be free, and then you can use it. I think cost for apps is one, but not all the measurements of quality. Just because you pay doesn't mean it's better.
Right.
Just because it's free doesn't mean it doesn't cost you. I guess what I meant by that is this, that in fact, for those free models, they must have some reasons why they make it for free. One is they may just want to make a name out of themselves. Two is they may have advertisers that they want to bring in. Three is it could be a freemium model where they want to get you in and then say, well, to upgrade your service, you need to get that. So in some ways, free is not always free. But what I do recommend to the patients is usually try out the app, try the free ones first, provided you don't give up too much information for yourself, and then see how you feel about that particular type of app. If that works for you, then that app may well be the right app for you to stay, or you may want to start investigating some apps with cost options. And then to see if online reading or talking to health professionals, whether those that you pay is better than the one that you get for free, and then go from there. There's enough free apps out there that you can try them out right now for the different kinds of ways to do it. And there are some apps that are more costly. For example, some of the tracking devices out there that you do need to pay for that has some advantages over just the free apps. But I think cost is but one of many factors to think about.
Okay, Iris, you had a comment as Kendall was speaking.
Actually, I do. If anyone is concerned about downloading an app and about giving out information, like Kendall said, one of the things, if you have basic computer knowledge and you know how to use a program, maybe like Excel, and I hesitate to name programs, but any program, you can create your own app. You can put in what you want to keep on that information with your doctor's advice and consultation, and then you can store it online. And all you would be storing is the information about what you're keeping track of, whether it's your blood glucose, your exercise, or your weight, or anything else. And that way you're not releasing any private information about who you are, your age, or anything. And there are many programs that allow you to store online, free.
Right. One of the questions that's come in is someone is fascinated by this concept of an e-patient, and they're wondering if digital health would allow for easier access to a second opinion in Canada. And so that's kind of an interesting kind of way to look at it. And I know at Canada Health Infoway with some of the patients, we've also met that, you know, one patient was actually traveling internationally, and they had a patient portal that they had access to. And so the clinical team where she was able to access her medical record and provide her services that otherwise probably wouldn't have been possible. So The second opinion is, I'm not sure if here we're advocating for Dr. Google as the second opinion, but it is that we're ensuring that more of the clinical team, and it's a team that you get to decide as a patient, who do you want to be part of your care team that has access to. So have you found that you share this information with your clinical team, and is that helping them make better decisions for your care, Iris?
In my case, yes. I am a diabetic, and I track my blood glucose, and it is actually a thing I've created myself to track my blood glucose, because I found that the apps online just didn't do it for me. And I just hand my iPad over to my doctor, and she skims through it. She's got the information. She gives it back to me. It saves her time, saves me time, and we're on our way.
So you've hit on an important point there, and it goes to your privacy issue that you brought up earlier. And someone was saying, if we start using digital health, does that mean it's accessible to anyone, anywhere? But as a patient, you decide who needs to have access to this. And some of that access, as you say, can be by just showing them the iPad or whatever device you're using, or it could be electronic access as well. And so some of the portals and apps that are developed actually allow patients to say, this is who I consider part of my care team, and then it gives them access to that. Are you finding that with most of the apps, Kendall, that you're looking at? Is it, you know, it's a sort of tripartite agreement between the app, the patient, and the clinician?
Yeah, absolutely. So I think many of the apps are very helpful to the individual patients, for him to her to participate actively in their own care. And so, for example, to be able to monitor your heart rate or monitor your blood pressure, for example, is very helpful to the patient. Historically, someone with high blood pressure can read online and say, you know, oh, this is how you manage hypertension. Now, there are opportunities where you actually can track your blood pressure, take the medication, and figure out how that affects your blood pressure, as opposed to going to your family doctor's office to get your blood pressure measured. So I think that's very helpful. And Iris really support how she uses it in terms of blood glucose, work with her family doctor, trusted family doctors, so that the doctor can work with her in terms of the type of data. Health professionals may not be reading the patient's data 24/7. That doesn't mean they don't care. What they need is essentially making sure that the patient doesn't go out of the limit. For example, the glucose go too high or too low. When it's normal, it's fantastic. But so health professionals also need to partner with the patient in a trusted way to say, how do we work together on those type of apps? I do want to come back to the question about the second opinion. I think that's a very good question, and thanks for that insightful question. I think the underlying piece to that question is, does the patient have trust with his or her care team? I think, you know, in many ways, you know, all of us do emails to each other, we tweet each other, we form Facebook to each other, and that's a digital way to keep us to connect. Right. And then we can continue to expand the circle over time, but you don't abandon your friends. So in the same way, I think what Iris talked about is the fact that she has a trusted care team around her. And so when she ventures out and looks for other information, she has that team to be able to bring back and say, is this going to be helpful to me? And so I think the question about that second opinion, yeah, digital health will allow people to access better or a wider access to second opinion. But at the end of the day, I don't want digital health technology to fracture the relationship between patient and their trusted health team, because that's going to be the key core to keep the patient's quality of care high and keep the patient safe in doing so.
Right. We are getting some questions around, you know, is this type of service, so we've heard some, because you two are from the province of British Columbia, we've heard some of the good things that are happening here in British Columbia. We're getting questions around, is this happening elsewhere in Canada, and is there provincial initiatives? And, you know, certainly at Infoway, we know of, you know, at least 4 provinces who are moving forward. You know, Nova Scotia, Saskatchewan, Alberta, Manitoba's doing some planning. So there's a lot of people are recognizing that this is going to change the way our health system is. One of the questions we've also had, and it's come up again here today, and it sort of is one that often lingers in the background around, and Iris, I think you're really poised to speak to this. It says, well, can patients really understand the results? And so, you know, you've said you have a particular condition, you know, you've probably been living with that, and you may, I'll let you answer that question.
Actually, yes. As a patient, you can understand the results, and what you don't understand, there are so many resources for you to look through. I just want to point out that if you're going to do the research on the web for information, the .com sites are business sites. They have a vested interest. Go to another site like .edu or even .gov. You're going to get more honest and true information. And as for other provinces, please don't forget, you are the patient. You are the one who creates what happens in your own medical team. If you start approaching your doctors and saying, look, I have this information, I have all my medicines written out, or I'm diabetic, here's my glucose, or here's my high blood pressure, you start the change. It lies with you.
Okay, very good. Some of the questions we're also getting around, it sort of goes back to the privacy question, and maybe I'll direct this one to you, Kendall, is about, okay, people are concerned where their information is stored, and how do they know if an app is storing their information in the U.S., and then is that subject to the Patriot laws there, and, you know, there's a whole bunch of questions. So do you have some insight to that?
Yeah. So I think for your doctor's electronic medical record, for your hospital's electronic health record in Canada, there are rules and governance over those data. So we're not talking about those types of data because it has its own important privacy provisions and confidentiality provisions for those. In terms of apps, at this time really is Wild West. And that's why it's very important for the individual when they sign up to understand what they're disclosing about themselves. At this time, FDA, the U.S. governance group, FDA, is trying to regulate or at least approve some of the health apps. But the volume of health apps coming is impossible for them to go that fast. Health Canada is looking into some of those type of things. But at this time, when you go into the app, the type of information you give, consider that public information. I don't think you can consider that private, even if you read through the app and say, you know, we'll keep your privacy, etc. Sometimes they do honor it, but then other times, like for example Facebook, when they change the policy, suddenly some of your details get released without you having a say on it. So at this time, I would suggest that if you go in a public app, that you do go with caution. The type of information you give out, be careful, and assume that it can get released.
Okay. Certainly there are many healthcare institutions and even provincial initiatives that, and maybe we're sort of going down the path of that, but we should also sort of talk about, there's many patient portals that are available where patients are inputting their own data. They're also looking at their results, and many of those solutions are stored here in Canada, and they're abiding by our privacy laws here in Canada. So, I think there's, besides apps, there's also many things that patients can benefit. And Iris, you mentioned that, that you look at your lab results. Your lab results aren't specifically coming from an app you've signed up for. It's actually from a portal here in British Columbia. And there's other tethered portals to various clinician offices or things like that that people are using that, again, it's from, the information is stored here, and it's, so we don't have those concerns per se. And so I don't want to get our audience thinking that we're just talking about apps. We're also talking about other forms of digital health. I know at Canada Health Infoway, annually we do sort of consumer tracking. And we found over the last number of years that there's 4 things that Canadians want. So I'm going to test Iris to see if she wants all these 4 things. So the one thing you've talked about already is you want lab results. So that's one of the top things that Canadians say they want. They also say that they want to be able to refill or renew prescriptions online. Now, is that something you think you would want or you use now or have the ability to do?
To me, I think that that would be an excellent idea to have my prescription filled online. It saves you from getting out. If you're elderly, you don't have to go to the doctor's office. If you're pregnant, but on the other side of the equation, and you don't have to fight traffic, you don't have to sit in a waiting room. We all know doctors are notorious for not being in time. A few are, and I thank them. But it happens. It's easier. If it's a prescription that I'm taking for any length of time and I know it's working and my doctor is in favor of it, yes, it's easier.
Okay. The third thing they want to do is be able to book their appointments online.
Oh, yes, please.
And finally, the last thing they want to do is be able to communicate with their care team online. So whether that be sort of messaging back and forth, or some have even gone so far as doing video conferences with their patients. And so is that something, again, you can see yourself using, or do you use right now?
Unfortunately, no, but I would also love to have that ability, especially for people who are in remote areas. And in rural areas, I think this would be an excellent boon.
Right.
Even people in the city, you're busy, you're no point stressing yourself out if you don't have to. And if the doctor can sit down for 10, 15 minutes and consult is over, both are happy. As a patient, you have written out what you need to tell them. I think it's a huge help to both sides.
And then are you journaling any of your health information right now? Like you're keeping track of your glucose levels, and so you're doing that and you're sharing that with your healthcare provider now through your iPad app. Are there any other things that you're doing right now as far as capturing your own information?
I also created my own. Again, I'm a great thing with lists. I believe in lists. So I've created my own to track my food intake, to track what I've done for exercise. Some days, I'll be quite honest, I don't follow all my little points to do. But it shows me why I've faltered, why I haven't been able to complete something. It just shows me how I'm doing throughout the day. And I believe in computers. I believe in making them work for us, and I believe we can make them work for us. And to me, nobody should be afraid. Do what comes naturally, and if you come across an app or something that doesn't feel right, you don't have to go through with it. Move on. Go to another one. And think of how helpful it would be if you're traveling. Even just out of the city and something happens, you have the information with you.
Right.
If you have to go to emergency in another town, it saves so much. It's such a good thing for your own peace of mind.
Kendall, I wonder if you can comment then on, patient-generated data. So how does that affect you as a clinician? Like, what do you do with that? Is it a bother, or does it actually help you figure out a treatment plan or, a care plan for the individual patient?
Yeah, two thoughts there. One is that in the patient's self-tracking data, there are nuggets of information in there that we would want to know about. For example, diabetologists have always asked patients in the beginning of their diabetes journey that they track the glucose, so that we can then watch the journal and say where the fluctuations are so that we can adjust medications better. Once the patient becomes very conversant, very proficient in using glucose tracking, we don't pay as much attention to it because the patient becomes expert themselves, that they can track it. So afterwards, those information becomes much more helping the patients as opposed to helping the health professionals in those cases. Until that time that the patients start to go fluctuating again, and we partner with the patient and say, what caused this fluctuation? Is it a recent cold? Is it a gastroenteritis? Is it something else that caused that fluctuation? So we'll work with our patient. And so point number one, that in the patient tracking data, we need to filter out what are the key nuggets that we as health professionals can best partner with our patients on that.
Mm-hmm. Mm-hmm.
I think point number 2 is this, that I think the data itself is so much more important to support patients in their healthy living.
Right.
One thing we don't do well when I give talks about this, one slide I usually put up is a dancer dancing in front of a mirror
mm-hmm.
with the instructor and fellow dancers. We don't do that enough in medicine. The dancer, when he or she dances, he would ask the coach, you know, how can I make the dance look better? So the instructor would say, do this, do this, do this. And then the dancer himself or herself can immediately see it on the mirror with the instructor.
Right.
And if he or she can't figure out their community of dancers with them, who he or she would see and say, well, that person can make that line. How do I talk to that person to figure out how to make that line?
Mm-hmm.
In medicine, what we do is we do as a bit of, you know, a partner with our patients, say, you know, for diabetes, you know, change your diet, sleep better, etc. So those are things that are there.
Mm-hmm.
But the patient's own tracking and journaling, as Iris has put, is really the best practice to say, that's the mirror. I can now see myself not only figuring out how to do that, and here's how I do it, here's how uniquely I do it. And so that helps us as health professionals reflect back and say, great, that's fantastic dancing on diabetes management. And also, the reason why I think many patients are very interested in peers is exactly that they can then leverage the opportunity to say, well, that person can actually control the weight very well. That other person can sleep very well. How do they do it? Let me talk with my peers so that I can understand how they do it. Mm-hmm. And then when they share their own tips, for example, when Iris shared her tips with others, Iris herself gets the satisfaction to say, here's the tip that I learned. I'd love to be able to empower my group, my patients, my fellow patients to support better care. So on those 2 points, I think tracking, journaling, vitally important in terms of supporting better care.
Okay, very interesting.
And it all comes about because you actually cared enough to find an app or create one that works for you, create a list that works for you so that you can help your care team help you live better. Find out about the information. It's so easy. It's so easy to do. You know, just it's all there for you. You have to make the change.
So it's interesting you say, Iris, that you need to make the change. And so what's that first step that people need to do? Because often, you know, if your clinician isn't necessarily using technology yet and, you know, you're not sure whether they're going to be intimidated by this or not, what was that first step that you took, and what would you recommend others to do to sort of, you know, talk to their clinical team about the use of these kinds of tools?
The first step is to realize that you, as a patient, are important in your own health care. You have to be proactive. Your doctor doesn't have a crystal ball. They only know how you feel and what is wrong when you tell them. It could start with something simple, like when you go to visit your doctor, you make a list of what you want to talk to him or her about. Make it short, keep it simple, and don't be upset if your doctor doesn't talk about all 10 points. He may talk about number 10 because that is the most important and impacts on the 9 above it. And it starts from what you start on paper. You will graduate to something electronic, and do not be afraid. If it feels right, go for it. If it doesn't, keep looking.
Okay. All right. Kendall, and you know, you on the other receiving end of that, like, how are you and your colleagues feeling these days about patients who are coming, you know, armed with all this digital tools at their fingertips?
Yeah. So I think on the partnering arm of working with patients, I think some of us embrace it. Some of us a little bit pre-contemplative to say, wait a minute, you know, with all this, how do we work together? And the avalanche of data, I won't have the time in my visit with the patient to be able to go over all the data. So some of us will be a little reluctant and say, well, let's deal with one thing at a time to start. So I think there'll be a range of responses. And I think some of us may also be very reluctant to say, I want to engage in this conversation. So all that will occur. I think we're in a very exciting time of change. And so in this time of change, you would expect a group of us to have different responses. But I like what Ira said is the fact that I think all of us focus on the quality of care. All of us, health professionals, want to make sure that the care is patient-centered. And so if our patient says, these data are important to me, I'd like to have some degree of interpretation of it. I think the health professionals will make adjustment to say, well, today it's important for us to deal with this, but maybe tomorrow let's look at this part of the data as not as urgent, but yet important for the patients.
Right.
I think in terms of recognizing that kind of partnership would be vitally important for us as health professionals, because at the end of the day, the way medicine is being practiced is changing very rapidly. You know,
right.
20, 30 years ago, without the type of data and the knowledge on the internet, we have been, in some ways, the custodians of those knowledge and say, let's share it with our patients and work together on it. Today, it's flipped around. There's so much information. We need to help our patients to sift through what is accurate information, and not only what is accurate information, what is accurate information that's relevant for my patients.
Right, right.
And so in sorting out those two questions, we need to figure out what that new partnership looks like.
Okay. We've also had a question, and it's not surprising, we've had a question of cost come up. And so, yes, and I'd like to hear both of your comments on this, but certainly digital health does cost, but I think there's probably also a cost to not doing it. And so we have to balance those two things. And so Kendall, like, you know, I think there is a remuneration issue that needs to be dealt with around clinicians doing some of these e-services, that they can be recognized as services. But in terms of cost, do you have any comment on that? Or?
Yeah. So I think maybe three comments. One is, I think it's important at this time of change to be responsible to make those changes. We need to measure cost. Because I think the days of, you know, hey, we can just put resources in and forget about costs, those times are over, especially with the current economic climates and things. So I think any of us, we absolutely need to make sure that when we do change, that we do measure and evaluate to say, does it save cost? There's no question in, for example, e-prescribing, it saves cost. No question about that.
Right.
That, in fact, when it's well used, you prevent adverse reactions, you save money on not only prescribing medication, but also the outcome.
Right.
So those types of cases need to continue to be demonstrated. But I think the second is this, that it's important for our patients that they really want this. And so as health system, health professionals, we need to support that. But I think the third is even, in my mind, more important. At the end of the day, what's the value we choose? I mean, we choose our clothes, we choose our car, we choose our houses, we choose where we live, not because it's the cheapest, but we choose it based on a set of values within us. What do we value as the Canadian healthcare system? What do we value in British Columbia? What do we value in terms of patient-centered care? And from that perspective, then we can start assessing costs to say, is it value for money, as opposed to, is this the cheapest?
Right, right. I know certainly at Canada Health Infoway, on all of the investments we do, we certainly do a benefits evaluation on many of our projects. And in the consumer space, for example, e-booking, the savings that clinician offices can accrue can be great, you know, so it can be now staff are freed up to do more other activities that they may not have been been able to do previously, or that the staff satisfaction, not only the patient satisfaction of actually being able to book that appointment online and not having to be on hold, but that staff satisfaction also goes up because now they're not, you know, sort of juggling all the phone lines and keeping people on hold while they try to look for patients, or, you know, rescheduling is now much easier because they can do it with, you know, some clicks of the buttons. Now, granted, putting in any of these systems also requires a lot of change management to be done, and so we can't think that this is easy. And I think, Iris, even for yourself, as a patient, there's a lot of change that needs to happen in order to think about using some of these digital tools. And maybe you can just sort of walk us through, because I think we only have a few minutes left, that, you know, in order for us to change, what are the steps we need to do? How do we need to sort of think about incorporating digital health into our lives so that it becomes an integral part and we shouldn't be scared about making that step?
I think that the changes that we have to make, again, come from within. You have to be proactive in your own health, and you have to be able to collaborate. You really have to be able to collaborate, and you have to be open to learning. We also have to remember that we want changes. It's great to be able to electronically get a prescription refilled. But somewhere along the line, our medical team, our doctors need to have some sort of remuneration for it. We can't expect them to do this for nothing. So even though it frees up time on both sides and makes it easier, we have to understand they are professionals and they are entitled to something in consideration of the time they approve the renewal of the prescription. We just have to be able to work together. We should never be reluctant to discuss something with our doctor or reluctant to take something to our doctor because we feel it's minor. It could not be minor. We have to be able to work together. You'd be amazed what your doctors and your healthcare professionals know if you give them a chance.
On that sort of subject of change as well, you know, technology is becoming more ubiquitous in our lives, and so people can, you know, do just about anything from the internet anymore. But taking that next step to do it in healthcare does seem to be a bit of a challenge for some, and so I'm glad to hear you say, Iris, that you got to take that step, but you know, you got to take it and measured and make sure you understand the consequences. On the flip side of that, then, Kendall, like, are clinicians ready for the change, and what do we got to do to support that change?
There's when we were starting this journey about a year ago, that we did a survey of BC clinicians. In fact, I think the results, I can't remember exactly, but at least 7 out of 10 physicians that we surveyed said, if the patient wants this, we will change. And so I think it's very important to hear from the patients what they need, as Iris said, and how important it is. Because sometimes we get buried in thinking, you know, medically this is where we need to go, and not that we exclude what the patients think, but sometimes we just get so preoccupied with the medical emergency that we did not pay attention to it.
Right.
And there's also a Chinese thing, I'll quickly say that. I'm Chinese, by the way. You can't see me. There's a Chinese saying, a mouse doesn't know how to pull a turtle when the turtle's in the shell. Sometimes the digital health is so vast that I kind of know that's helpful, but where do I start? You know, where do I start tugging the tail? And that's part of the reason why, very fortunately, Iris has agreed, and also another patient partner, and also a group of health organizations tonight, we're having a digital health event, a public health event that's both for the public to participate in Vancouver starting at 6:30 p.m. or webcasted so that people can join across. The idea is to engage the public in discussing about where our e-health space, but also what specific ways that they can start that journey. So we're very, very hopeful that in answering your questions, where do we start, we're hoping that forums like that and also continue to discuss with the patients will help us start finding ways that we can get into the e-health system to benefit each other.
Right, right. And I know certainly from projects that Infoway has invested in, the more successful projects are the ones that have engaged the patients right from the beginning, included them in the decision-making. And I love the Patients Canada saying that, you know, is with me or
nothing
without me.
Yeah, exactly. Yeah.
And so I think that is an important context that we need to keep in mind in this because it's true. We know there's lots of apps that are out there. There's you know, other functional portals and things like that. But sometimes it's not what the patient needs. You know, we may think we know what they need, but the best way to find out what someone needs is to ask someone like Iris and what would be useful to you and engage you in that conversation, in that dialogue. And then, Iris, I like how you've also said, but you also need to do it the other way around. So you as a patient also needs to engage your clinical team in thinking about how to use digital health for both parties so that not only you're gaining by it, but the team is able to help you that much better. So I think all of that kind of comes together nicely. And I'm anxious to hear what happens tonight in your event, Kendall, because I think that will, we'll hear more of that and how engagement happens. We just have a few minutes left. If there's any sort of last-minute burning questions, I'd encourage our panelists to keep their questions coming, and we are trying to answer all of them, and I apologize if we haven't gotten to each and every one of them. There is one here. Is there evidence yet that digital health improves patient care? And Kendall, I think you have seen some of that. I know certainly from the benefits evaluations that we've done at Infoway, we sort of concentrate on access, quality, and productivity. And we have seen increases or improvements in each of those three areas in some of the consumer health projects that we've sponsored. And can you comment on that as well?
Yeah, actually, I just came back from a conference, American conference on informatics. No question about electronic health record improving the process of care, but the use of electronic health data that leads to improvement of quality health outcome. So I just want to separate the implementation of EHR to improve the process to the actual intelligent use of the data for decision support to improve care. Definitely there's evidence in that.
Right.
And also there's good information now, case studies on looking at how digital technologies like wearables are starting to make impact.
Great.
I think a lot of research needs to go into there. And also in the area of e-prescribing in cancer care, in terms of better use of medication and safer use of medication, again, strong evidence that digital health is improving care.
Perfect, perfect. Okay, well, I'm going to sort of wrap things up for us here. So in closing, here's some contact information for Kendall and his team. Here's my information here at Canada Health Infoway as well, so please feel free to contact us. A reminder that this is Digital Health Week. We're into Thursday of the week, so it's the end of it, but we ask you to join us and help celebrate, get involved. You can see all the information here on this slide, so please do get and think digital and there's lots of activities taking place. Spread the news throughout your networks and keep the dialogue going. Kendall has mentioned the event tonight. Anything else you want to add about this event, Kendall?
Yeah, also anyone's welcome. If you go to eHITS.BC, you can sign up for the webcasting access to our event so you can watch it online. I really want to thank the BC Ministry of Health, Patients as partners, as a very strong partner in this event. Also want to thank Canada Health Infoway, again, as a national partner in working together with us, with a panel for discussion. We are looking forward to that opportunity for a dialogue like this, both electronically and live tonight.
Excellent. There's some resources here we've put up on our slides, or a Better Health Together site where all of the Digital Health Week information is there, plus the eHealth information from UBC. Also want to remind people about our Imagination Challenges at Canada Health Infoway. We've just kicked off another one, a Data Impact Challenge, where we're asking Canadians to input their questions that they want health researchers or others to answer with the data that they have available. Again, follow us on Twitter. Our handle is @Infoway. You can look at our Facebook page, and I think that's about it. Iris, thank you so much for coming in today. It's been a pleasure talking to you.
Thank you for having me.
Oh, it's been our pleasure. Kendall, great. Thank you for participating in this as well.
Thank you.
I'd like to thank everyone who helped put this event together, and I wish everyone a good day or good afternoon, good evening, depending on what part of the country you're in. Thank you very much.
Thank you.
Thanks.
Thank you again for joining us today. This concludes today's web conference. You may now disconnect.